breast tissues after the implantation. So we are measuring the dimension of the chest, and we have to fulfill this space with the implant. So we are measuring the dimension of the implant for the chest, which is fitting to her, and the patient can decide which form or dimension they want or projection. So there are smaller or higher projections, 4 types, or even shapes are different. It depends on the patient desire and the shape of the body, how we can fulfill. This is in UAE the most popular, the high projection round implants, because they can get big cleavage. So when we are doing the surgery, I'm always explaining the before, this is the rib cage, and if we are putting the implant above the bones, it covers on the upper pole with the muscle. Here, this wide muscle is covering the implant. That's why the décolletage is looking very natural, because it's covered with more human tissues, and the lower part is under the glandular tissues, so it's not so visible and palpable. And the nipples should be on the highest projection. So this is around 40% of the implant on the upper pole, 60% on the lower. So it gives very nice aesthetic result, and normally people can't see that this is implant, and most of the time people live with that for lifetime without any complication or problems. Ladies thinking that only 10 years guarantee of their implants, but not. Nowadays we are telling that the implant can stay in the body if they are not having any problem. 10-15 years after the surgery they can make an MRI which shows exactly where is the implant, do they have any problem with the implants, and at that time we can change. Most of the time people would like to exchange for bigger size when they have another pregnancy, or when they have some sagginess, or they want bigger sizes. So it's easy to exchange these implants and devices, and they are totally safe products. They are chemically and physically stable implants, and nowadays very high restrictions and control of the devices. So there is no any unsafety on these procedures. The surgery itself 1 hour or less with general anesthesia, and after the surgery the patient's having some discomfort for 2-3 days. They can't do physical exercise for 1-2 months, but it's short time, and they can get good result for lifetime.